I'm a professor in gender studies at Liverpool John Moores University. In 2020, during the COVID-19 pandemic, I was diagnosed with a rare form of appendix cancer, pseudomyxoma peritoni, or PMP for short. This experience led me to undertake a small piece of research to find out the experiences of other cancer patients. What our survey found was, although the experience that people had in hospital was excellent, after discharge, people were left very much on their own, with 59% of patients saying they received no rehabilitation after surgery. This short film highlights the stories of people at different stages of their PMP journey. It shows how exercise can help with both physical and mental well-being.
I was diagnosed with appendix cancer in 2014, and that's all I knew at the time. There wasn't much information really back in 2014 about what appendix cancer was, and it was in September that year that I was referred to Basingstoke Hospital, the NHH, and Mr. Mohammed, who I saw for a consultation, and he told me that it was pseudomyxoma peritonei. First time I'd heard that term, that was all a real shock. I had no idea that that was coming.
It's a cancer usually that comes from the appendix. It can come from other areas. And what happens is that as it grows, it kind of bursts through the wall of the appendix, produces a sort of mucin, which will stick to anything that's within that cavity. It'll just keep getting bigger and bigger and bigger, and people end up with this jelly belly or this distended stomach. They can look like they're pregnant. It can come out really far.
I had some pains in my ribs and general appendix pain, but didn't really pay much attention to it. I thought I'd just pulled a muscle or was overtraining. And then by chance I got food poisoning at a work's Christmas party. I couldn't get rid of the bacterial infection itself for a couple of months. And luckily in A&E the on-call consultant was a general surgeon, and he recognised some of the symptoms. My belly was very distended, and so he did a CT scan and noticed that there was widespread malignancies.
I think we sort of say that you can either have low grade or you can have the high grade. The high grade being the one that is maybe more aggressive, can grow quicker, is perhaps more difficult to get rid of.
It was a high grade PMP. We then decided to try chemo locally, so I had 8 rounds of chemo. Unfortunately that didn't have an effect on the cancer at all, so it was then that I asked for a referral down to Basingstoke to find another option.
Most recognised treatment is a procedure which we kind of refer to as the mother of all surgeries. So there's only 2 hospitals in the whole of the UK that will deal with pseudomyxoma peritoni. One's the Christie in Manchester, and then Basingstoke.
Woke up one morning with really severe stomach pains, and went downstairs, had a cup of tea. It wasn't getting any better. Got to A&E, doctor on duty came in. She said, well, there's 2 things. The thing that's causing the pain or what have you is you've got a kidney stone. So there was something next to the appendix which we said we'd also need to investigate. I went on my own to see the surgeon to get the results of my appendectomy and the biopsy. And obviously one of the things he says, sorry to tell you, but you've got cancer. He said, looks like you've got, and he did know it because he actually did know about PMP. So he said, you've got appendix cancer, and it looks like you've obviously got pseudomyxoma peritoni. And so it's never even heard of that before. It's like, what's this mean? What are the treatment options? And all I remember was he kind of said, or I misinterpreted it, kind of no treatment or nothing. It's like, hang on, this is like really bad. It's like there is nothing. Whereas actually, it was more the watch and wait scenario.
That's so particular to our type of cancer. So it's generally slow growing, isn't it? And then they're not quite sure. They want there to be a bit of a mass before they would operate, so that they know that when they go in, they're kind of heading in that direction. But when it's mucin and it can just be sort of here, there and everywhere, they will often say to patients, we're going to watch and wait. And so we're not going to do anything, we're just going to observe you and see what happens.
PMP was a bit of a shock. I'd never heard of it before. Started getting lots of strange symptoms, putting on weight, strange tummy pains, pains in the bottom of my feet. Went to the doctor several times. They sent me for tests. Didn't didn't put two and two together. Ended up waking up one morning in absolute agony, ringing 999. Got blue lighted to Lincoln Hospital. They kept me in for 2 weeks doing tests and things. Found out I'd got a massive tumour which was 18 by 24 centimetres. So that would explain why I couldn't lose weight and was putting on weight. After I'd come out of hospital, I had another appointment to tell me I'd be going to Nottingham to have surgery. So I just stuck my head in the sand, didn't listen to anything else. Good job my husband was there because I took nothing on board. And then a week later I was in Nottingham having mother of all surgery.
What happens is that they open you up, and once they're inside, they'll work out what needs to be removed. If they see that the cancer's sitting, say, on the outside of your gallbladder, the patient is told all this before they go in for their operation, but really they won't know what will happen until they wake up and what's being removed and what's not. But once you're under anaesthetic, they're putting in hot chemotherapy, and they leave that inside for a while and sort of squish it about and move it about to agitate it, because what they're trying to do is get that hot chemotherapy to go into all the little crevices to kill off any existing cancer cells that they've not been able to sap when they've gone in and scraped it.
I was in hospital for 3 weeks. My operation itself was probably fairly straightforward. I had a right hemicolectomy, my mentum was removed, and I had peritoneal scrape. A piece of liver was taken as well, and I had the high-pec chemotherapy wash at the time. It was the recovery which was difficult for me in hospital. I had some setbacks where my bowel wasn't waking up properly. So it took a full 3 weeks pretty much for my bowel to come back to life enough for me to be well enough to go home.
7 hours where they took 10 plus organs, including my large bowel, part of my stomach, my spleen, my gallbladder, full hysterectomy. I had to high-pec for an hour, and they were quite happy after that they'd managed to get all signs of the visible disease. 6 months down the line, had another scan, the monitoring scan, and unfortunately found out the disease had reoccurred. I had an opportunity to be part of a clinical trial at the Christie. Unfortunately, I could only, because it was so toxic, I could only really tolerate about 8 doses of that treatment, although it was thought to reduce the volume of disease that I had by about 10%, which was great.
I had the operation in November 2020. Next thing you know is you wake up in ICU, tubes everywhere, can't walk, can't feed, can't do anything. So you are literally helpless.
Ended up staying in hospital several weeks, and when they came to send me home, they still hadn't got a diagnosis for me. All the things they'd sent off to be analysed still hadn't been analysed. My consultant wasn't very happy. Went back for my appointment with the consultant, which was a couple of days before Christmas, to find out I'd had cancer. I'd had PMP, but it was in the wrong place. It's normally derived from the appendix, but my PMP was on my spleen. Apparently, if I'd found out I'd got PMP before surgery, I'd have gone to Manchester or Basingstoke and had a chemo bath while I was in surgery. I haven't had that. Basingstoke had all my histology. They went through it all, eventually came back to me in March to say I wasn't having chemo, I didn't need chemo. And then I think it was another 3 months after that before I really started being able to walk properly. I had no physio, they didn't send me for any physio. So I started going to a local Pilates group, which was amazing. I definitely recommend it. It really helped me. The lady that ran the class, she used to change what I was doing for my particular need, and that was my recovery really.
Within a matter of days you move from ICU to the ward, still plenty of tubes and what have you attached to you, and again that's when the rehab starts. So one of the first things is obviously that the Basingstoke specialists are very trained in terms of trying to get you active as soon as possible.
So at both the Christie and at Basingstoke, I had some physio in terms of meeting a physiotherapist when I was on the ward, and they took me through a few different exercises that I could do and sent me home with a leaflet.
I've been a physiotherapist now for about 30 years, and part of my role is to work with cancer patients on recovery programmes after they've been through treatment. The challenges for this group of patients is immense because the surgery is so complex. It really is a beast of a procedure that these patients go through. The recovery straight afterwards is harsh, and there's a lot of complex issues that they have to come through for bowel health, getting fluids to a normal level, but also being able to get patients to start moving again and being more active. And that is a real challenge for them.
I was fortunate enough to be part of a programme with Sue and some of the other patients from pseudomyxoma survivor.
Each week, we had a little step machine, Zoom or what have you, and we all kind of got together, marched up and down, did our little exercises, and that was very good actually.
So in lockdown, PMP survivor got in touch on social media looking for a physio who might be able to help some patients on recovery programs, and I just responded to that and set up a program online for them to see if we could help them whilst they were either shielding or coming out of surgery and needed some support. So the main benefits for patients is that we get them back to the things that they enjoy. So working with a physio will improve their strength, will improve their stamina and their endurance, will make them cardio fit again, will improve balance, memory, coordination, and all the things that do often get affected by drug treatments.
Exercise for me is everything. Before I was diagnosed, exercise was a huge part of my life. I'd become to be partly competitive when I was with a local triathlon club. Post-diagnosis, it kind of changed how I was able to do things. My operation left me with an ileostomy, which is quite a high output ileostomy, quite hard to manage. And as a swimmer before I had my surgery, I was pretty worried about what it would be like swimming with an ileostomy. A lot of people kind of said I didn't need to be worried about that, but it was something I had to find out myself. Myself and a friend hired a private pool, and we were able to experiment and kind of work out what it was like to swim with an ileostomy without the public kind of looking on. Exercise is and still part of my recovery. The kind of muscular base and the fundamentals that I could get from physio, everything could then function better. I could sleep better. I was in less pain. I had a lot of pain from instability caused by the surgery.
Foolishly, I decided that I was going to do an Ironman triathlon before I went into hospital, which is a 2.4 mile swim, 112 mile bike, and then a marathon straight after. I needed something that was going to move me and give me sort of positive progression after my operation, give me something positive to look forward to. It would have been very easy, I think, with the pain that I was in, to not train, or not to take myself out of my comfort zone, which was what I needed to do. So after my operation, I had 10 months to prepare for the Ironman. The feeling of well-being I got from that was massive, because I felt like I was getting better. Every day I felt like I was achieving something new that I hadn't done the day before.
Going forward, as I got stronger, I wanted to get better because I'm on something called watching weight. So I started looking into what I could do to get physically stronger. And as I used to like a little bit of running, a little bit of walking and a little bit of cycling, I decided to join the local tri club.
We'd come up to the 1 year mark and your next scan results come back. They said there's actually, we could see some shading on your scan. September 2022, when they could see on the scan there was a bit of progression with this shading of the disease, and said you're going to need to come in for another second kind of cytoreductive surgery and high-pet chemo. And then before you know it, I'm back down to Basingstoke, November 2022, having another Mara surgery. So seeing the same surgeon, same nurses, so you're back again, yes. I was in for 2 weeks, came out after the 2 weeks in hospital, and my ability to recover because of my mental state or my physical state, it was so much more quicker second time round. So as I said, I came out again, probably like end of November, I think, this time, and I was certainly back cycling or running, I think, in kind of January. So I'm not recommending that to, aspiring that to like certain patients, but again, I think it was probably almost like a 8-9 week recovery. I was kind of back doing proper exercise.
And tried to do a structured program before I went into hospital. And that really helped, actually. And it's only since my operation that I've heard the term prehab, not a term that I'd heard at all before that. And of course, that's exactly what I was doing. I was preparing myself for the operation.
Loads of medical evidence to say that if you're as fit as you can be before you go in for your operation, the recovery will be quicker at the other end, and you'll heal better, and you know, you won't go down that kind of spiral of depression.
I made it to race day, and I always thought to myself, if I can get to that start line, then I've won. But when you stand on that start line, you are, well, that's not enough. I need to finish. I need to get my medal. You know, there's no way I'm not going to finish this race. Mass start, so there's over 2,000 people swimming together, all bashing into each other, dunking each other, pulling on each other's legs. It's not easy, but I got that done. Big relief. And then got out on the bike. You know, no punctures, no problems with the bike. Did exactly what I wanted to do. And then all I had to do was run a marathon after that. You're on your feet then, it's just you and your trainers. It's easy, isn't it, then? That's easy. All I've got to do is run a marathon. Yeah, not so much. That was tough. That was really tough. And I think that's when my operation came back to bite me. I just ran out of steam. I was sick. By that point, you're just in the process and you get it done, you know, and I did. And I plodded round. I reached that red carpet at the end and got over the line, and it was brilliant. The relief of finishing and knowing that that whole year behind me had finished, and what I'd achieved in that year was unbelievable. It meant that I wasn't a victim, I wasn't a cancer victim. I was living with cancer, but it was part of my life that I could cope with, that I could control to a certain extent and could manage. I haven't lost sleep thinking about the cancer since then. Strangely, I probably wouldn't change what I've been through to get where I am today.
I think it's made me more positive, as in looking at the outlook and living for the now, doing things now, don't wait till later. I like to get out in the open air as much as possible, and where I can, go for a swim. We've got a little camper van, so we like to go away and have weekends away, and we do have more weekends away than we've ever had before, because you've got to live life for the now.
Google is never your friend. Try and obviously find the specialist cancer charities or cancer sites as quickly as possible, and then use the kind of community resources online. So I just wish everyone else who finds themselves in this position, yeah, all the best. And as you can see, I'm here. Touch wood, coming up to 5 years since my first diagnosis, so I'm still here now, fit and healthy.
If your body's allowing you to do something, you should do it. You know, don't sit back on it. Everything that you can train for, you can break down into small parts. And every part of that can be progressed. And it doesn't have to be in 10 months like I did it. It can take several years, but you can progress and you can get these big dreams done. And why not dream big, you know? That's what life's about.
Own your own journey and make sure you kind of acknowledge what's happening to you, accept what's happening to you, and just go about everything as positively and as energetically, I suppose, as you can. Knowledge is power. Go as full-armed as you can to appointments. Make sure you write down as many questions that you have. Bring a notebook. Get somebody to come along with you to write down what the consultant says, because by the time you get out of that room, you won't remember. Try and be the #1 advocate for yourself. Health professions are too busy to take on everybody's individual needs, so fight for yourself. Try not to sit down and let things happen to you. Be proactive and go out and look for look for things to make your situation better, as good as it can be. In September, I'm about to do a 90-kilometre bike ride as part of Chris Hoy's Tour de Four, which is about raising funds for cancer charities, trying to change people's perceptions of what it is to live with stage 4 cancer and what actually is possible if you put your mind to it.